We started our free clinic 10 or 9 years ago, and at that time there was somebody who we got to meet who had started a free clinic in Red Bank. His name is Dr. Eugene Cheslock. He's going to be our first speaker. He received his medical education in the New Jersey College of Medicine and Dentistry, now UMDNJ. He trained at the Cleveland Clinic and the Albany Medical Center, where he was a fellow in hematology. He's board certified in both hematology and internal medicine. He practiced hematology and oncology for 25 years in Monmouth, and he serves in several capacities at Riverview Medical Center, most recently vice president of the Riverview Medical Center Foundation. Dr. Cheslock was one of the founders of the Parker Family Health Center, a response to local critical need to take care of the poor. He received many awards during his career, including his selection in 2006 as a Purpose Prize Fellow, a national recognition for social innovators. Please welcome Dr. Eugene Cheslock.
Hi. So, how are you?
Good, how are you?
Nice to see you. Good.
This busy medical clinic looks like most any other, but it's not.
Like a lot of people, I didn't have any medical insurance, and I had no place to turn to. My situation got really acute when I was no longer able to work.
Has anything changed from your last visit?
No, nothing.
The Parker Family Health Center in Red Bank, New Jersey, is one of 60 clinics throughout the country that are part of Volunteers in Medicine, the only national nonprofit organization dedicated to opening clinics to treat the uninsured.
I always thought it would be a great thing to be able to care for people and not take money for it. Don't ask me why. Who's on this week?
So Dr. Cheslock partnered with Volunteers in Medicine, a growing movement where retired medical professionals are mobilizing to volunteer their services to address the healthcare crisis in their local communities.
So we had the bright idea of using a trailer, and on July 29th, 2000, we opened to the tune of 2 patients.
7 years later, the trailer is gone, and the clinic is now housed in a new building, completely paid for, handling more than 12,000 visits per year from local uninsured residents.
Okay, there you go, buddy.
All of our people that we care for are young, working, looking for work, constructive. They're not hangers-on.
I got what I could afford, which was this Zitra, whatever it is.
When you practice in a place like this, it's why we went to medical school. It's you and the patient.
With some exceptions, nearly all the medical personnel treating these patients are volunteers.
Medicine is everything I've done. It's all I know. I've had a wonderful life, and it's time to share it with people who haven't had such a wonderful life. And since this is all I know how to do, this is what I can give back. And again,
I'm not proud that I'm able to do this. I'm grateful that I'm able to do this.
Mammogram, August, good.
I can't tell you how many women here we found with early stage breast cancer by really, really focusing on getting people to get screening and so on. But once we do that, the patients that we see for free, because they qualify here, don't necessarily get free services elsewhere.
And yet, Dr. Cheslock and his compatriots have been able to convince the local hospital, Riverview Medical Center, it's in the community's best interest to provide additional specialized services. Their support is critical.
So even though we have specialists that work here, we need outside specialists to help us. Procedures to be done, colonoscopies, all this sort of thing. So somebody has to help fund this. So Riverview's role in this has been huge.
Okay, good. Nice and clear. Let's take a look at your feet.
It takes $500,000 a year to run the clinic. Most of the money comes from businesses, residents, and grants.
The thing about medicine is it kind of draws you in. You know, it's not something you retire from. So I've been a doctor so long, I just can't stop being a doctor. And I find that's true with a lot of other physicians.
Basically, the sad state of affairs in America is that a whole lot of us can't afford to be sick. They're doing some godlike work here in Red Bank.
It's a pleasure to be here. I'm thrilled to be here, and congratulations to all of you for getting into the thick of things to represent us as we should be represented going forward. I've had the pleasure of knowing Dr. Eck for quite a while, and I will tell you right now, this venture has been the most exciting thing in my medical career, and I think Dr. Eck presents it as a platform for the physicians who hopefully will benefit from her pending legislation. Let me just update you on a few things. We are 12 years old now, 12,000 visits a year, soon to pass 100,000 patients seen over those 12 years, with a budget of now $1 million. Roughly 600,000 goes into personnel payments for individuals, nurses, etc., clerks, to assist the volunteer physicians. We have one paid physician who's a medical director, Dr. Carmen, who you saw, who was a gastroenterologist at one time. Proudly, I will tell you, not one penny comes from the government. Dr. Eck has alluded to the fact that FQHCs are there. Yes, they are there. But I evaluated an FQHC in North Jersey that sees similar number of patients, same services, $11 million budget, and this was about 4 years ago. We have malpractice protection through the Federal Tort Claim Act, and it has been tested and it works. As long as we comply to credentialing and risk assessment of individuals who want to practice at the Parker. We have over 200 professionals who donate their time, approximately 70 physicians representing multiple specialties and now including active physicians. So we are not all retirees. Over 200 professionals, including nurses, RNs, NPs, pharmacists, donate their time. I will tell you, it's an auger plate. It's very dynamic. We have seen a change in the demography due to the terrible condition of healthcare under increasing government legislation over time. When we opened in 2000, 95% of our patients were immigrants, the majority of them were undocumented. Over 50% of our patients now are U.S. citizens. Makes it a little easier to raise a buck. It doesn't make it easy to raise a buck. There's no professional charge. That allows us to get the Federal Tort Claim Act. We ask for a copay for drugs if you can afford it, $10 per prescription. If you can't, we eat it. We take up to 300% of federal poverty guidelines for our patient population. They are all working poor. If you're above that, we kind of ask you to somehow give back to the foundation because we are a 501c3. If you do the math, 12,000 visits, $1 million budget, it comes in under $100 per patient. And a lot of that occurs because we have a great ally whom you heard about, the Meridian Healthcare System, and the closest one to it is the Riverview Medical Center. We are presently working with Monmouth University to evaluate the true worth of our efforts in the community to use as a fundraising vehicle. We have a model in Connecticut, the AmeriCare's 3 clinics that valued their services in 2010 at $6 million. $6 million, we think we're doing the same thing in Monmouth County at no expense to the taxpayer, at no expense to the system, if you will, in a cheap venue, if you will, but with great care and we offer our diabetic management team's statistics to show you that because you render free care, it is not less quality that you're offering to the patient. In fact, because of time spent per patient and because of the oversight that we have with nobody there drumming us for time or money, our diabetic patients have better control of their hypertension, their hemoglobin A1C, their blood sugar, and their diet. And we have over 350 active diabetics amongst our patient population. It may sound all rosy. We have no retention problems. So you say, what is the problem? Why aren't there more of them? And there are 3 or 4 others in the state now. There are 85 in the country. So you could see this movement has a lot of momentum. Our biggest problem, I've alluded to, is fundraising. We have been fortunate in that Mr. and Mrs. Bon Jovi have been great supporters. They built our building. They continue to support us in the course of our lifetime. We hope they never go away. I close now. If we have a couple of seconds, we'll entertain questions. Otherwise, I thank you for the time, but it can be done, and it is being done. And you guys are the key players, and Dr. Eck, I wish you well in your endeavor to enlist and educate legislators to find out that the spirit to give is alive and well in us if we can provide a platform for them to use and not penalize us for it. Thank you.